I want to welcome Aaron Taylor to today's podcast. Aaron is with the Allegany County Health Department. Aaron, why don't you introduce yourself and tell us what you do over there?
Sure. Thanks for having me. I am the Medical Assistance Eligibility Supervisor for the Allegany County Health Department, Maryland Department of Health. And we have 5 other caseworkers. I do some casework as well. We help with anything Medicaid, medical assistance in the Maryland Health Connection.
So all that translates down to you help people get health insurance.
We help people get health insurance, yeah.
Okay.
And we solve a lot of problems. So if it's not, Medicaid or, there are different types of Medicaid as well. So whatever it is, usually we can help you, we can point you in the right direction.
Since this is all about how to get help, when should someone call you?
I encourage anyone who is either uninsured or underinsured to call us. The number's going to pop up at 301-759-5076. You can call anytime. We're open Monday through Friday, 8 to 4:30, and get some more information about how we can help you, whether it might be one of the Medicaid medical assistance programs or possibly one of the qualified private health plans.
Right.
With financial assistance, but really from new applications or just help with a renewal.
Let's talk about quote-unquote state health insurance and Medicaid and managed care organizations. Decipher some of that for folks.
In the state of Maryland, there's 9 or 10 what we call managed care organizations or MCOs. And those are the Medicaid insurance companies. In our area in Allegany County, we have Maryland Physicians Care, WellPoint, Priority Partners, Aetna Better Health, and Care First Community Health Plan. The biggest one, the most popular by far, is Maryland Physicians Care. They work like an HMO in that there are no out-of-network benefits. The vast majority of doctors in our area accept that one over the others. But not to say that the other ones aren't really good. They all offer a very similar benefit package as far as prescription coverage, major medical. I think you might have $1 or $2 copay for just prescriptions. Everything else, if it's in network and it's a covered service, it's free. Eventually, we want to get everyone into one of those managed care organizations. So if you have Maryland Physicians Care, that is Medicaid.
What would you say to somebody who wants to call, maybe to get information for somebody they know?
If they're already enrolled in the Medicaid program, unless you are listed as an authorized representative, there's nothing that we can tell you about that. Again, it's very easy to add someone, a parent or a significant other, as an authorized rep. In general terms, we talk to people all the time that want to get general information.
Somebody who doesn't have health insurance and they want to get it, what should they be thinking about before they call you? What could they kind of prepare beforehand just to make the call go a little bit easier and maybe get them a little further along?
The most important information is how many people are in your household and how much money do you make.
Now, when you say how many people are in your household, most of the time we're talking who's on that tax return. When you, head of household, files that tax return,
yes,
it's the people listed there.
Exactly. And there's some key dates to kind of, and again, this is why it's hard to do these applications if you have a complicated tax household by yourself, because you'll see an applicant put their grandmother and their 35-year-old sister who just moved back home, and that's really not kind of what we're looking for as far as the taxes.
It's not necessarily the people who live in the house.
Right.
It's the people who are legally bound together.
Right. It's not about what you made in 2022 or what you think you're going to make so far in 2023. It's all about, for Medicaid, what are you making today going forward? What are you making right now, and what do you expect to make? And that's what we're going to base your eligibility on.
Can you talk a little bit about maybe they can get some coverage going back a month or two?
All Medicaid goes back to the beginning of the month that you apply in. So if you lost your job today, at the end of July 2023, it goes back to July 1 as your effective date. Now, the problem with retroactive, we can look at 3 months prior. So April, May, June, we could cover any unpaid medical bills for those months. But the way we look at your income for those 90 days is different than how we look at it going forward. If you do have unpaid bills in those months, we need to have every pay that you received in order for that month, that you received in that month.
So basically, the income still has to be at that eligibility level for the prior months that you want coverage in.
It still does, yeah, but the system will always ask for verification of those. So you almost have to have those pay stubs in order to get approved.
So let's talk about verification. You mentioned pay stubs.
So the system, the Maryland Health Connection, is it's connected to a lot of other systems. So when you put in your income, if it's off by a certain percentage, it's going to ask for verification of that. So if you just lost your job today and you say you have zero income, it's going to ask, probably for a verification. You can use the app. You can call the call center for the Maryland Health Connection. The DSS can help with these applications. David Stewart at AHEC West and Western Maryland Health Insurance Connector has a lot of navigators.
Call either the health department or AHEC first.
Yes, we're your best bet and fastest to kind of get through the system, because that's what we do. That's exactly what our purview is.
And for folks out there, we're local people helping local people, right?
Exactly, yeah.
And so it's better to go to the local folks first. But if you can't, for whatever reason, which would be very unusual for someone not to get a hold of either one of our programs,
Sure.
You can still go to Maryland Health Connection. I would say, why not just have somebody help you through the process?
It's so easy to just walk in. There's no appointments at the health department. Monday, our walk-in hours are a little bit different than our actual hours. We see walk-ins Monday through Friday, 8 to 3:30. So you don't need an appointment. Just come in. It's the main doors to the main building at the health department. It's the same place where you would go to get birth certificates.
Where is the health department, just so folks know if they haven't been there before?
Sure. It is right across the street from the UPMC hospital. The address is 12501 Willowbrook Road. And there's two health department buildings. We're the one that connects to the hospital across the street via the Sky Bridge.
It's closest to the road.
Closest to the road, yep.
Yeah.
Again, number 301-759-5076.
Aaron, thank you for being here today.
Thank you, David.